I am Dr. Jithin and today we'll discuss how to approach X-ray shoulder joint. So we know shoulder joint or the shoulder girdle is a complex joint consisting of the three bones, clavicle, scapula and the proximal humerus. Therefore, no single radiological projection shows the true shape and true position of the bones. But the most common or the standard view is the AP view, that is beam of the X-ray is oriented in the sagittal plane, which can be taken in internal rotation or external rotation. Today we will discuss the standard view, that is the AP view of the shoulder. Other views include the true AP view, axillary view, modified axillary view, scapular Y view, etc. Okay, so today we have a X-ray right shoulder AP view. So how to approach a shoulder X-ray? So it is better to approach bone by bone with its different corresponding joints and its relation to the particular bone. So first examine the clavicle. So here we have the clavicle. Okay, so this is the clavicle. This is the clavicle. Medially it forms the sternoclavicular joint, which is not visible here, and laterally it forms the acromioclavicular joint. Here you can see the acromioclavicular joint. So examine the acromioclavicular joint for its alignment and placement. Okay, and also examine the shaft of the clavicle, because it is one of the most common bones to get fractured. Then the scapula. So examine the lateral border. So this is the lateral border. So in a bigger X-ray, we can also see the medial border as well as the superior border, which is not. So here is the superior border. You examine that. Then the spine of the scapula. The spine of the scapula that eventually terminate in the acromion process. So this is the spine of the scapula that eventually terminate by forming the acromion. The spine of the scapula that eventually terminate in the acromion. Then there is an anterior projection. There is a anterior projection, the coracoid process. So this is the anterior projection. The anterior projection. The coracoid, the anterior projection. Okay. Then finally the glenoid cavity. So mark the glenoid cavity. So this glenoid cavity articulate with the head of the humerus, forming the major part of the shoulder joint. Okay, you can examine it for any dislocation. And finally the proximal humerus. The proximal humerus, where you mark the anatomical head. So this is the anatomical head. The anatomical head, the greater tubercle. This is the greater tubercle. Then the lesser tubercle. So here we have the lesser tubercle. Then the anatomical neck. So this would be the anatomical neck here. The anatomical head, anatomical neck. Then this together forms the surgical head, consisting of the greater tubercle, lesser tubercle and the anatomical head forms the surgical head. And here we have the surgical neck. So somewhat here we have the